This is the third lecture dealing with cardiovascular responses in exercise. Just as a reminder, in part 1, we looked at the relationship between cardiac output and heart rate and stroke volume. And basically this was talking about how much blood is pumped each minute. Mathematically, what is the cardiac output? In part 2, we looked at the Fick equation. And that was, again, involved cardiac output, but this time it was, how is the cardiac output used? And how it was used was to deliver oxygen to be used by the cells, and especially the muscles, to produce ATP. Now we're looking at a third relationship that involves cardiac output, and this one is how. How does the body cause this blood to be pumped? What is the mechanism? How does it happen? Now I'll explain what this third relationship is. Cardiac output equals mean arterial pressure divided by total peripheral resistance. I'll say it again slowly. Cardiac output equals mean arterial pressure divided by total peripheral resistance. This is a special formulation of a relationship that holds true for many, many systems that involve flow. Flow rate, in this case, cardiac output, how much blood is flowing from the heart each minute, is driven by a pressure. In this case, the driving pressure is the mean arterial pressure, the average pressure in the artery through systole and diastole. Over time, the average pressure in the arteries. And then the flow rate is inversely related to the resistance to flow, which in the cardiovascular system is named the total peripheral resistance, the overall resistance to flow. Now, we've talked that blood is forced from the heart during systole. And you know that blood pressure is described as the systolic over the diastolic, the driving pressure over the resting pressure. And yet in this relationship, what's important isn't just the pressure of systole, but the average pressure. And mathematically, it does make more sense that it's the average pressure that's going to affect over time, over a minute, how much blood is being pumped. How do we determine the mean arterial pressure? That formula looks a little complicated, but what it simply says is, at rest, the mean arterial pressure, the average pressure, is 1/3 of the way above the diastolic towards the systolic. I've shown that in the lower right-hand corner in yellow there. You can see that blood pressure goes up to 120, down to 80, up to 120, down to 80. So your blood pressure is 120 over 80. Now, you can see that the heart spends more time in diastole than it does in systole. So the pressure spends more time down at 80 than it does up at 120. So to calculate the average, we go 1/3 of the way between the two. So a typical value for mean arterial pressure would be 93 millimeters of mercury. Lowercase m for millimeter, uppercase h, lowercase g, hg for mercury, millimeters of mercury. So 93 millimeters of mercury is a typical mean arterial pressure. In exercise, the systolic pressure may be 220 millimeters of mercury, and the diastolic pressure is unchanged. Now, it should make sense that the systolic pressure goes up because in exercise you know the heart beats more forcefully. It should also make sense that the diastolic pressure does not change during exercise because this is what the vessels look like at rest. Yes, there is more blood in them, but they are also dilating. So diastolic pressure should stay unchanged in exercise. Now, if you're into cardiac rehab, you are going to study both the systolic response and the diastolic response, and you will learn that you might expect a slightly lower diastolic during exercise, and you certainly don't want an increase in diastolic. But we're just going to say during exercise, systolic blood pressure goes up, diastolic stays the same, and therefore the overall driving pressure, the mean arterial pressure, goes up in exercise. So, I've already answered the next bullet. What are the effects of exercise? Cardiac output increases because the MAP increases. Because the heart is pushing the blood out with more force, more pressure, cardiac output increases. And then I've said here, and oh, by the way, total peripheral resistance also decreases. Both of those things contribute to an increase in cardiac output. Let me just explain that in terms of general terms, not the cardiovascular system, but go up to that equation on the first line. Flow equals pressure divided by resistance. You want to increase the flow of something, you push harder, and you reduce the resistance to flow. So if you make the MAP greater, cardiac output is greater. If you make the TPR lower, cardiac output is greater. Now, it's important that you understand this relationship as it is shown right there. Flow is directly related to pressure, inversely related to resistance. As you shall see later in the lecture, we don't always look at things from the point of view of the cardiac output. Sometimes we look at things from the point of view of blood pressure, mean arterial pressure. And we can rewrite this equation so that mean arterial pressure is on the left-hand side of the equals. And I will do that later. This is a relationship that you really need to know backwards and forwards. And you have to appreciate and be willing to accept that as we look at the equation now, we're saying what causes a change in cardiac output? Well, it's a change in MAP and a change in TPR. Correct. But given the fact that we could rewrite the equation that MAP equals cardiac output times TPR, you can see that you can't always say that two of them cause the third. They're all interrelated. They all, changes in one cause changes in the other. But from the point of view of this, cardiac output is driven by MAP, inversely related to total peripheral resistance. Now we'll talk a little bit more about total peripheral resistance. What is it that determines the resistance to flow? In any system, it is the length of the vessels, viscosity of the fluid, and the diameter of the vessels. First of all, length. The further you have to pump something, the more resistance there is. So the farther your house is away from the town's water tower, the lower will be the flow coming out of your faucet. Have you ever connected 4 garden hoses together and then plugged them into your neighbor's faucet to wash your car to save on water? Well, if you said, no, I never have, of course that's a good thing, but it's not a good thing to do anyway because the length of all that hose produces so much resistance that the flow is very low. And what happens in exercise to the length of the vessels? we can say there's no change. Obviously, the vessels themselves don't stretch in exercise, but since in exercise we do open up more vessels to allow blood to flow through them, the functional length in the system does change a little bit, but it's such a small effect that although we have to tell you here that length is a factor, we are not going to worry about it during exercise. Move on to the next one, viscosity. Viscosity, by definition, is a quality of a fluid, and it is defined as its resistance to flow. So clearly the quality of the liquid determines the resistance to flow, which, going back to that top equation, helps determine how much flow you will have. What are some things that are very viscous? Syrup, molasses. It's far more viscous than water. So if you pour water out of a container versus pouring honey or molasses or syrup out of a container, the water flows faster because there's less resistance because of the lower viscosity. What happens to the viscosity of the blood during exercise? Well, let me ask you, if you're going to put syrup on your pancakes and the syrup isn't flowing well, what can you do to the syrup to make it flow better? And don't say I'll squeeze the container, because that's changing the pressure. That's not changing the viscosity, the quality of the fluid itself. So what can you do to the syrup? If you said heat it, good for you. That is something you can certainly do to lower the viscosity and make something flow more easily. There's another answer out there. It's what we did in my house. I call it the lower middle class answer. You can water it down. So two things potentially can happen to the blood in exercise. Its temperature can change, and the amount of water in the blood can change. What does happen? Because you're exercising and your muscles are breaking down ATP, a lot of that energy goes to mechanical movement and force production, but 80% of it goes to heat. Remember, we're 20% efficient. So of all the energy we use, 80% of it goes to heat. So the body heats up, the blood heats up, the blood becomes less viscous. What about the water content? If you remember, in an earlier lecture, I said when you first stand up, when you first start exercising, you squeeze a lot of plasma out of the blood, so it actually becomes thicker, which works against you here. The fact that you lose plasma means your blood becomes thicker, viscosity goes up, total peripheral resistance goes up, and that works against cardiac output. Now, having said that, if your blood is thicker, I want you to think back to the Fick equation. If your blood is thicker, it can carry more oxygen. The cells are more concentrated, or the concentration of the cells is greater. So the concentration of red blood cells and carrying hemoglobin is greater, so you can actually carry more oxygen in each liter of blood. So there is a bit of a trade-off, and you have to be thinking back to the Fick equation. There is a bit of a trade-off, a negative effect on cardiac output, but a positive effect on CaO2, the content of oxygen in the arterial blood. So this effect of plasma volume loss, this effect to increase viscosity, isn't as bad as you might think. What's the third factor that affects total peripheral resistance? Diameter, and notice that says diameter raised to the -4. Another way of saying that is 1 over diameter to the 4th. Now what that tells you is a small change in diameter has a large change, or has a large effect on total peripheral resistance. And just for fun, what you might do as a take-home assignment is calculate what is the effect of a 10% vasodilation on total peripheral resistance and consequently on cardiac output? What is the effect of a 10% vasodilation, and also what is the effect of a 10% vasoconstriction? I'll give you a hint how to do that. If you don't want to hear the hint, close your ears for the next 20 seconds. Here's the hint. Start out with a diameter equal to 1. Start out with the diameter equal to 1, and then increase it 10% for vasodilation, or decrease it 10% for vasoconstriction. All right, you can uncover your ears. What are the effects of exercise on the diameter? Well, remember we said you have sympathetic activity in exercise which causes vasoconstriction, which means the vessels get smaller. But in the exercising muscle, you have local humoral effects causing vasodilation, so the vessels get bigger. So now you've got these two effects. Some vessels are getting smaller, some are getting bigger. What's the overall effect? Well, the overall effect is if you're using large amount of muscle, so if you're running, jogging, cycling, swimming, dancing, then you're going to have more vessels dilating than you're having constricting, so the net effect will be an increase in diameter, which translates into, and be careful, you'll have an increase in diameter, which translates into a decreased total peripheral resistance, which contributes in a positive way to the cardiac output. Now, I'm showing you next, putting some numbers here for you. The first one, cardiac output equals MAP over TPR. The first one is values at rest. Resting cardiac output, 5 liters per minute. Resting mean arterial pressure. I said it's 93, but here, just to make our math easy, I'm just going to say, well, it's about 100 millimeters of mercury. Okay, you can do the math. Then the total peripheral resistance must be 20. And this is one of those cases where I'm not going to make you use the units because they're just ugly and we don't need to worry about them. 20. Total peripheral resistance is 20. All right. You know that the cardiac output can go up to 25 liters per minute in an untrained person during maximal exercise. And I just told you in the previous slide that blood pressure can go up to 220 over 80. So the mean arterial pressure is halfway between those two. It's about 150 millimeters of mercury. So now you can look at this and do the math and say, well, the total peripheral resistance must be 6. So in this large muscle aerobic type exercise, your total peripheral resistance is reduced dramatically. Why is this important? 2 reasons. 1, as I told you in the earlier lecture, you're getting this effect in the exercising muscle. You're getting vasodilation of vessels, dilation of vessels in the exercising muscle, which attracts the cardiac output along this path of lowered resistance to the exercising muscle where it's needed. That is a thing of beauty. Blood being pumped from the heart follows this path of least resistance to the muscles where it is needed. Okay, that is a thing of beauty. Second is the effect we're talking about here. The local vasodilation causes a reduction in the overall, the total peripheral resistance. So that we have this increase in cardiac output with what is really a rather modest increase in blood pressure. Here's another math problem for you. What if total peripheral resistance did not decrease? What if it stayed at 20? what would the mean arterial pressure and what would the systolic and diastolic pressure have to be for you to be able to pump 25 liters of blood per minute if your total peripheral resistance was 20? It's a good little assignment. Now, I've been talking about large muscle exercise where you've got this vasodilation taking place in a large number of muscles. If you use only a small amount of muscle in exercise, and very often this is accomplished, or this occurs if you're doing upper body exercise, which could be anything as horrible as hammering nails into the ceiling to doing arm cranking, or pushing a wheelchair. In this case, with a smaller muscle mass, then you might actually have more areas being affected by the sympathetic vasoconstriction, the activity of the sympathetic nervous system, than you have experiencing vasodilation caused by these local humoral effects. In this case, total peripheral resistance can actually increase during exercise, which means you really have to push the blood hard in order to generate the flow you need. So if you look at the equation at the top here, if total peripheral resistance goes up, then MAP is really going to have to go up a lot in order to generate any kind of increase in cardiac output. So this becomes a consideration in small muscle or upper body exercise. And one group for whom this is particularly important is cardiac patients. And cardiac patients, their hearts can only work so hard because they have coronary artery disease, because their vessels are blocked. Their heart can only work so hard, and of course, if it tries to work harder, if it tries to work so hard that it's getting inadequate coronary blood flow, then the heart is going to be trying to exercise aerobically without getting the oxygen it needs. It's an aerobic muscle. Part of the tissues can actually die if this continues. Now, what happens is they don't die, but they experience this lack of oxygen, and it's translated into a very characteristic chest pain called angina or angina pectoris. So if a person is not getting adequate coronary blood flow, and this occurs in people with coronary artery disease, heart patients, they will experience angina. Angina is it's described as a crushing pain like having an elephant stand on your chest. Now, how many of you have ever had an elephant stand on your chest? Okay, me neither. But I actually have experienced angina, and it is a horrible, crushing pain. It is not a sharp pain. It's almost like the worst indigestion you've ever had. Clearly, you want to avoid this. And it occurs in patients when their heart is working at a particular level. Well, how do we quantify the work of the heart? How do we measure how hard the heart is working so that we can tell a person, don't work this hard? Well, how hard the heart is working is a combination of how fast is it beating and how forcefully. How fast is it beating? What is the heart rate? How forcefully? What is the systolic blood pressure? So we use what we call the rate pressure product, the product of heart rate and systolic blood pressure, to determine the work of the heart. And in a heart patient, you might learn that at a particular product, it might be 22,000, the person experiences chest pain. So you say, well, don't get your rate pressure product up this high. Now, the deal is half of that product is pressure. So you don't want a person doing something like upper body exercise, which is going to give you an exaggerated blood pressure response, because that's going to cause chest pain at a rather low cardiac output, at a rather low heart rate. So it's important in heart patients to estimate the work of the heart, to use the rate pressure product to do so in order to avoid angina. And to avoid angina, you generally avoid small muscle exercise because of its effect on total peripheral resistance. So this is just another way of looking at this relationship. Cardiac output equals MAP divided by TPR, and approaching the problem by saying, ooh, what is something that could have a bad effect on TPR? Small muscle exercise. Now I said you had to know this equation backwards and forwards, and now I've rewritten it from the point of view of MAP equals. So I've just rewritten the equation. MAP equals cardiac output times total peripheral resistance. Why would you do this? Aren't we interested in cardiac output? Well, yes, we're interested in cardiac output, but certainly for someone who's got high blood pressure, we're interested in the factors that determine blood pressure. So in this case, cardiac output and total peripheral resistance are the factors that determine your blood pressure. And so people with high blood pressure are one issue. Another time that we're concerned that we want to put MAP on the left-hand side is if you're concerned that your blood pressure is going to go too low. This occurs when someone goes into shock. So we need, these are two reasons, someone going into shock, someone with high blood pressure, that you would want to look at the relationship this way. And just to help you understand this relationship, we're going to look at it from the point of view of what are some of the things that we do to control or treat high blood pressure. So what are some of the things that we can do to the right-hand side of the equation to cause a lower blood pressure on the left-hand side of the equation? And I've just listed a few of common treatments that we do for high blood pressure, hypertension. One is beta blockers. Beta blockers are a class of drugs that block sympathetic activity. If you block sympathetic activity, that means you are blocking the effects of sympathetic activity on the heart, where sympathetic causes an increase in heart rate and an increase in stroke volume. So you're blocking those two things. So you've got two ways there that you are reducing cardiac output. So on the right-hand side, you're reducing cardiac output by reducing heart rate and stroke volume. And you're blocking sympathetic vasoconstriction, so you're also lowering total peripheral resistance. So beta blockers are potent in dropping a person's blood pressure. I sometimes tell a story about a marathoner friend I had, and he volunteered as a research subject in a study where they were using beta blockers, and they gave this massive dose of beta blockers to people who volunteered. And of course, people who volunteered were healthy people with low blood pressure. And this guy's name was Roy Benson. It hit him so hard that we worked in a fitness program. And one day he went out jogging with one of our clients. And he came walking back and he said, oh, I couldn't keep up with Mabel. And he couldn't keep up with Mabel because his cardiac output was so low and his blood pressure was so low, he was getting ready to pass out. And you know, you're saying, well, so what, he couldn't keep up with Mabel? Well, the thing was, Roy was a marathoner and Mabel was an 85-year-old woman with bad knees. The effects are incredible. And you just want to understand why blocking sympathetic activity would lower your blood pressure. Calcium channel blockers, if you remember, calcium channels occur at the end of neurons. Just prior, they're involved in the synapse. And if you can block the calcium channel blockers of either sympathetic nerves or motor neurons affecting the heart, then you're going to lower cardiac output and again lower blood pressure. Regular physical activity. How many of you are kinesiology majors? Okay, well if you're kinesiology majors, then you know that regular physical activity cures everything. Hey Bob, how you doing? Well, just great. I used to crave bad food and smoke cigarettes, but I started exercising, so I don't do that anymore. Yeah, I used to never use my seatbelt and drive like a madman, but since I started my regular physical activity, I'm just a calm guy on the road. And my blood pressure. How's my blood pressure? Well, here's the deal, folks. If your blood pressure is 200 over 80 at rest, I mean, you've got high blood pressure, and you start a program of regular physical activity, you might expect over time that your blood pressure might drop from 200 over 80, maybe all the way down to, 196, 194 over 80. That's not, physical activity is not a cure for blood pressure. Is it a good thing to do? Yes. Does it have positive effects? Yes. Might it help lower the amount of medication you need to take? Yes, but it's not a cure. Sorry. Reduced salt intake. Oh boy, anymore, the nutrition folks are trying to lower and lower and lower the amount of salt that's in the diet. Right now, your daily requirement is somewhere is far less than a teaspoon. And they want us to reduce it even more. Why? Well, the explanation is that salt in the diet gets into the blood. Salt in the blood increases the osmolarity of the blood, meaning it draws fluid into the blood, so it increases the blood volume. If you've got more blood volume, then just in and of itself, more blood in your vessels is going to increase the pressure. And it also contributes to a greater central venous pressure and Frank Starling mechanism, so an increased cardiac output. So the idea is if you reduce the salt intake, it'll cause a slight reduction in blood pressure, in blood volume, which will affect both sides of that equation, cardiac output and total peripheral resistance. Having said that, the effects of diet on high blood pressure are about the same as the effects of exercise. Is it a good thing to do? Probably. Is it going to replace medications? No. Stress reduction. Any health promotion minors here? How you doing, Bob? Just great. I started meditating. I do stress reduction, and now everything's fine. I just decided to quit smoking and eat right. Yeah. What does stress reduction mean? Well, stress is the body's response to stressors. And the response involves sympathetic activity, an increase in sympathetic activity. So when your boss comes up to you and says, "Give me that work done by Saturday," then you get a sympathetic response, which drives up your blood pressure, causes vasoconstriction, cardiac output goes up, total peripheral resistance goes up. This causes the increase in blood pressure, and you just sit there and fume, and then your blood pressure is going crazy. So if you can manage your stress, if you learn that when your boss yells at you, you just go, it's okay, then you may over time be able to reduce your blood pressure a little bit less than the effects of exercise or diet. So again, is it a good thing to do? Yes. Is it going to cure blood pressure? No. But for all of these, you want to be able to at least appreciate why it makes sense to do them. Last one on the list is diuretics, things that increase urine production. Water pills. Now, if you've known anybody who used water pills, they probably thought they were for weight loss. And no, that's not what they're for. That's what they get used for, but that's not what they're designed to do. The idea with diuretics is You increase urine production. Urine is made in the kidneys from blood by filtering water out of the blood. So if you increase urine production, you're taking more water, or plasma if you prefer, out of the blood, so you're reducing the blood volume. Look at your equation. If you lower the blood volume, in and of itself, Frank-Starling mechanism, you're going to lower the cardiac output, and because there's less volume in that container, in that cardiovascular system, you're going to lower the total peripheral resistance. So diuretics can contribute to lower blood pressure. So here's a separate way of looking at this relationship between blood pressure, cardiac output, and resistance. On this last slide, we're going to talk briefly about blood pressure after exercise. Now, if I were to ask you, why do you do a cool down after exercise? A lot of people will say, oh, I do a cool down so my heart rate will come down. If you want your heart rate to come down after exercise, don't do a cool down. Just stand stock still, and your blood pressure will come down and you'll probably faint. So the reason you do a cool down is to have a gradual decrease in heart rate, a gradual decrease in, and that's not what's important, it's a gradual decrease in your blood pressure towards normal. If you look for a second at what I've written here, the control of heart rate, or if you will, the control of cardiac output in exercise is neural. And really, although it does say heart rate there, think cardiac output. The control of cardiac output is neural, sympathetic, parasympathetic. The control of total peripheral resistance it's largely due to this vasodilation that occurs. So it's humoral. It's caused by the heat and the chemicals that are in the blood and put into the blood as the blood passes through the muscles. If you stop exercising, and now look at that relationship, MAP equals cardiac output times total peripheral resistance. If you stop exercising, boom, and stand stock still, the brain says, no more exercising, no more sympathetic activity, let the heart rate drop, let the stroke volume drop, the cardiac output will drop very quickly. All right, what's happening to the total peripheral resistance? It is low because of all these chemicals and because the heat is there. As soon as you stop exercising, does the heat go away and do the chemicals magically disappear? No. So if you just stop exercising, your cardiac output will drop rapidly, your total peripheral resistance stays low. What happens to MAP on the left-hand side of the equal sign? It drops rapidly and you will faint. So what you want to do is a cool down. And again, look at that relationship. You do a cool down so that your cardiac output gradually comes down, and your total peripheral resistance, as these chemicals get washed out and as the heat gets dissipated, you want your total peripheral resistance to gradually come back to normal, and your mean arterial pressure will gradually come back to normal, back down to normal, and you won't faint. And I'm going to leave you with one last topic, vasovagal syncope, also known as the ex-wife story. Vaso refers to vessels. Vagal refers to the vagus nerve, which is a parasympathetic nerve. And syncope is a three-syllable word that means fainting. Vasovagal syncope. You are aware of the fight or flight response. If you experience some pain or a threat, you get a large sympathetic activity. And again, if you look at that equation, a lot of sympathetic activity, your blood pressure will be elevated, your cardiac output will be elevated, you're ready to fight or flee. However, if you experience extreme pain, you don't get the fight or flight response, you get a parasympathetic response. Now, why does this make sense? Well, I'm guessing, but maybe, if you're being chased by a bear, you want to run as fast as you can. If you're being chewed on by a bear, it makes sense just to faint, pass out. It kind of makes sense because, who wants to feel what it's like to be chewed by a bear? And maybe bears don't like chewing on dead things. I don't know. But one way or the other, it happens. You'll pass out. And my example of vasovagal syncope deals with my ex-wife, who many years ago, of course, when she was my ex-wife, well, when she was my wife, long story short, we had, my parents were visiting for Christmas, and we'd rearranged some furniture, and we'd gotten out the good china and the good crystal, and she was clearing the table, and she had thousands of dollars of crystal and china in her arms, and she turned to walk into the kitchen, and we had rearranged some furniture, and she slammed her shin into a piece of furniture that we had moved, and we just heard step, 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 and then a big thump. And we went into the kitchen, and she had, yes, thank goodness, she had managed to put all the china and the crystal on the counter, and then she had passed out cold. And on the way down, of course, she got a concussion and broke some ribs, which, if it's your ex-wife, that's kind of funny. But she was out cold. This incredible pain of slamming her shin into this metal piece of furniture, she was out cold. Parasympathetic response was so great that her cardiac output just dropped. Her vessels dilated wide open, blood pressure dropped, and she passed out completely. I ran into her a couple of years after we'd gotten divorced, and she had gone off with this pig farmer. Not one of the best stories I have, but she'd gone off with a pig farmer. And I saw her, and she said she thought it had happened again. She wasn't sure, but she was going to climb up on a tractor. I don't know how many of you are familiar with tractors, but they've got these little metal steps, and she thinks that she kind of slammed her shin into one of these little metal steps. She's not really sure, but when she woke up, she was flat on her back in the mud surrounded by pigs. And if that's your ex-wife, then it's really funny. What do you take from this? The role of the sympathetic and the parasympathetic nervous system and humoral effects on this relationship that you can see between cardiac output, mean arterial pressure, and total peripheral resistance. So a quick summary. Remember, we have talked about what determines how much blood is being pumped. That's the heart rate times stroke volume. We use the Fick equation to explain how is the cardiac output used to increase the oxygen uptake. And the relationship that we talked about today explains the how, the mechanism. How is it that we increase our cardiac output and increase in exercise? And the answer, of course, is we increase the mean arterial pressure and we reduce the total peripheral resistance. And yes, you must understand this equation backwards and forwards. That's all for now, folks. Cheers.